We do not have a confirmed case of Brazilian strain right now in Medical Center Hospital.
A local doctor says the Brazilian variant of COVID-19 is not confirmed to be here in West Texas.
It's still being tested. Now a local mother is worried her son has the variant. He is in a hospital with COVID-19. ABC Big 2's Rob Duke joins us live at MCH. Rob, you spoke to the mom and the hospital.
Well, that's right, guys. The P1 strain, also known as the Brazilian variant, has been confirmed in the United States, but not here yet. Now, Dr. Garcia Fernandez of MCH says it's like the South African strain.
One of those mutations allow the virus to replicate and being contagious faster than the initial strains we dealt with of COVID-19 early in the pandemic.
While they can spread at a higher rate, it is not as deadly. Dr. Garcia Fernandez says there is a second mutation, however, that has medical officials on their tiptoes.
It's the second mutation allows the virus to kind of change the conformation of the protein spike, which is the base of the mRNA vaccines we're using, Pfizer and Moderna.
But there is assurance. Medical technology can evolve just as fast to deal with those new mutations, meaning vaccines are still effective. But Penny Roberts is left with questions and fear. Her son Jerry is in a medically induced coma. She says Jerry has COVID-19. 1 week ago, he was admitted to the ER.
And I said, Jerry, what is wrong? And he said, I'm having a hard time, Mom. The last text that I got from my son was help.
Jerry was at a wedding in Atlanta late March. He flew back and landed the 21st. When his condition quickly deteriorated, Jerry was taken to MCH in Odessa.
The next thing I know is they're venting him, so he is on a medical-induced coma now, and now he's on a machine that's keeping him alive, and now we have all these other regimens that we're having.
Jerry is an otherwise healthy person, a military veteran, a father of 2 9-year-old twins. He runs in marathons and competes in numerous sports. But even though doctors say the Brazilian variant isn't confirmed to be here yet in the basin, Penny is afraid her son already has it.
So he had to have gotten it from somewhere, and the only way we go back is the plane.
So we know of cases in different countries, not only in the United States, where there's no track of travel or contact with anyone that has traveled.
Now, doctors are still performing tests to see exactly what sort of strain Jerry has for COVID-19. Meantime, there are fewer admissions to MCH for COVID-19, but the hospital says they expect to see more cases involving the new mutations because of how fast it can spread. Live in Odessa, I'm Rob Duke, ABC Big 2 News.
All right, Rob, thank you.